Welcome to Nicklaus Children's Hospital's Pediatric Dental Residency Program Overview. This video highlights different aspects of our program, including the history, its curriculum, staffing, and facilities. Nicklaus Children's Hospital, formerly known as Miami Children's Hospital, was founded in 1950. It is South Florida's only licensed specialty hospital exclusively for children and is renowned for excellence in all aspects of pediatric medicine with several subspecialty programs. Our Pediatric Dental Residency Program was established in 2007, and on March 4, 2009, the Commission on Dental Accreditation performed its first site visit and granted full accreditation. The program was fully accredited again by CODA in 2016 and granted the accreditation status of approval without reporting requirements. The next site visit is scheduled for year 2023.
The Doral Center, where the dentistry program is located, occupies the entire third floor of this building. The program serves mostly disadvantaged children. Over 90% of our patients are insured through Medicaid or are uninsured. The 6,000 square foot facility houses our 14-chair dental clinic equipped with 8 radiograph machine units with one room designated for panoramic and cephalometric radiographs and a recovery area. It is equipped with nitrous oxide and sedation equipment. Oral surgery and limited orthodontics are available to patients. NCH also provides digital x-rays and digital dental records to assist in dental diagnosis and treatment.
This slide depicts the courses in our didactic curriculum. Lectures usually take place in the Doral Conference Room on the third floor and occur from 7 to 7:45 a.m. on most weekdays. The dental clinic runs from 7:45 in the morning to 4 in the afternoon. During this time, we see patients for preventive and restorative dental care. We also provide nitrous oxide and moderate sedation. Every other Friday morning, during orthodontic clinic, we render Phase 1 orthodontic treatment. Every couple of weeks, we have residents on oral surgery rotation in the clinic in the OR.
Nicklaus Children's Hospital prides itself on interdisciplinary care, and our residents are fortunate to work intimately with the many specialties in pediatric medicine. Our program offers the following rotations: anesthesia for 4 weeks, pediatric medicine for 1 week, hematology-oncology for 1 week, plastic surgery for 2 days, speech for 1 day, genetics and craniofacial recurring every 10th week, Borinquen recurring every 10th week, laser recurring every 10th week, and billing rotation for 1 day.
Our residents perform comprehensive oral rehabilitation in the operating room 2 to 3 times per week on pre-cooperative and anxious patients, as well as those with special healthcare needs. Exposure to the OR begins on day 1 of residency. Each resident is paired with an attending to receive one-on-one instruction. Residents complete 3 cases per day and an average of over 85 cases throughout the course of their 2-year training.
During spring of year 1, our residents begin their sedation rotation, where they learn about safe induction, monitoring, and recovery of the patient requiring moderate sedation. A sedation nurse is available at all times to support the sedations. We utilize a combination of nitrous oxide and various oral sedative agents, carefully selected and tailored to each patient. There is 1 resident assigned to sedation rotation every day of the week and complete 3 cases per day. By the end of the residency, our residents complete over 70 cases as operator.
Nicklaus Children's Hospital is a Level 1 pediatric trauma center. Call is a mandatory part of the residency program. Each week there are 2 residents on call, 1 first call and 1 second call. During the first 2 months of training, you will have a second-year resident assigned with you. Call will occur every 5th week initially, and then about every 10th week. An attending is assigned to oversee call and consultations.
Scholarly activity is a required component of our residency program. Residents are expected to conduct a research project following the scientific method, as well as prepare a manuscript following publication guidelines. The quality of the manuscript should be such that it has the potential to be submitted to a peer-reviewed journal. The residents also have the opportunity to attend AAPD annual meeting, sponsored by Nicklaus Children's Hospital, to present their research project. Here is a list of scholarly activity publications from Nicklaus Children's Hospital's attending faculty and residents. The names of residents involved in a publication appears in bold and italics.
We have a state-of-the-art mobile unit with 2 operatories fully equipped with nitrous oxide and delivery systems to perform restorative treatment. The mobile unit serves mostly uninsured children in South Florida and operates a few days a week. Additionally, attendings and residents participate in multiple health fairs where they do oral screenings and oral hygiene education. Lastly, through our training initiatives, we work closely with Borinquen Medical Center's GPR and University of Florida's AEGD programs. Every week, a resident and an attending oversee the provision of pediatric dental services at their facilities.
Our program is blessed to have a team of committed clinical and managerial staff. We have 1 sedation nurse, 20 dental assistants, 12 front desk receptionists, 2 billing coordinators, 1 OR coordinator, 1 residency coordinator, 1 grant coordinator, 1 clinic manager, and 1 clinic supervisor.
6 board-certified pediatric dentists comprise our full-time faculty. On the top from left to right, we have Dr. Arevalo, our program director, Dr. Aponte, and Dr. Freitas. On the bottom from left to right, we have Dr. Lolo, Dr. Minkin, and Dr. Miranda. Finally, we have Dr. Saman, who is our full-time senior research scientist. These are our board-certified part-time attending faculty. Dr. Briseño and Dr. Alquizar teach us interceptive orthodontics. Dr. Lozano guides us through oral surgery cases in the clinic and operating room. Last but not least, Dr. Savrin and Dr. Castera are part-time pediatric attendings, teach in the Doral Dental Clinic and Mobile Unit, respectively. These are our 10 pediatric dental residents from the class of 2021 and 2022. Our residents come from diverse backgrounds, enabling them to relate to the patient population we serve. We also have an even mix of residents in terms of dental experience. Some possess years of work experience, while some are recent dental graduates. Our residency program enjoys state-of-the-art facilities. Our Doral Dental Clinic has 14 operatories, 10 of which are equipped with nitrous oxide and are also available for conscious sedation, and 4 of them are open bay chairs for preventive care. A sedation area is available for induction and recovery of the pediatric patient, with a sedation nurse available at all times. Intraoral, panoramic, and cone beam 3D digital radiography can be provided in the dental clinic. Other radiographic and imaging studies are available to the pediatric patient at the main hospital. Our program recently introduced the use of laser. We have a hard tissue and soft tissue water lace laser that is used during our weekly laser rotation, where a resident works with an attending on simple operative procedures. The state-of-the-art conference room with audio-visual and computer equipment is available for conferences, lectures, and seminars. A study area is available to complete medical records, maintain patient logs, and request consultations of other specialists. NCH Library and Clinical Key are available to the dental resident as well.
Moving on to the office tour. First up is our front desk reception area. This is the first thing the patients see when they get off of the elevator. This is one area available to the patients for check-in and check-out. Upon entering the dental clinic, which is separated from the reception area by a secured door, this is what you will see. Straight across to the very end in this photo, you will see one of our 14 operatories. The halfway point is the attending station where the residents are able to discuss cases with the attending faculty.
This is a photograph of one of our standard operatories. We have 10 closed room operatories that look like this. Each of these 10 rooms are fully equipped with isolite isolation systems, nitrous oxide, and pulse oximetry and capnography monitoring. In this picture, you will see our water-laced I+ laser. This is an erbium chromium hard and soft tissue laser.
This is our open bay area where our pediatric patients receive preventive dental care. You see 2 chairs in this photo, but behind the cabinets is another section with another 2 chairs, for a total of 4 chairs. This is our sedation area where our pediatric patients scheduled for moderate sedation undergo induction and recovery.
This is the resident workstation with 4 computers available for clinical notes and radiographic review. This is a picture of the resident room. There are 10 workstations available and each resident is assigned to their own personal workstation. There is no tuition for a residency program. In fact, a stipend is available for all the residents. For additional information, please visit us on the AAPD and AdiaPass websites.
At Nicklaus Children's Hospital, we embrace a work hard, play hard culture. Learning and training to become the best pediatric dentist possible is just as important as the lifelong friendships we build along the way.
We are very proud of our program and feel it has many strengths. Here is a summary. We are fully accredited by CODA with status of approval without reporting requirements. Abundance of patients available, which ensures an excellent clinical training in all areas of pediatric dentistry. Approximately 29,000 outpatient visits per year. Surgical exposure. Over 85 cases per resident in the operating room. Sedation. Over 70 cases per resident as operator in the clinic. Extensive training with patients with special healthcare needs. Excellent advanced education didactic curriculum. Contemporary clinical facilities with close working relationships with the Department of Pediatrics and other medical services. Dedicated and well-trained auxiliary staff in pediatric and special needs patients. Optimal ratio of clinic attendings to residents. Full-time senior research scientists to support resident scholarly activity.
This concludes our presentation. We would like to invite you to a video conference session with our residents. This is a great way to personally meet our residents and offers an opportunity to ask questions. Please contact our Chief Resident, Dr. Vanessa Matamoros, by email to schedule. Thank you for your interest in our pediatric dental residency program at Nicklaus Children's Hospital.